Good morning to everybody. My name is Justin Hill and I'm part of the Innovation and Entrepreneurship Unit of the World Bank Group, and I'd like to welcome you all to this webinar that we're delivering with our colleagues in the bank in the LLI group. In the last few decades we have seen some quite remarkable technological innovation around the world, and I guess this webinar is just one example. And we've also seen very rapid social innovation and social change. I guess one of the examples is the urbanisation that we've seen around the world. I'm currently sitting in Delhi, which is an enormous city, and that urbanisation has driven all sorts of social innovation and change in social structures. But this change has often not been linked to economic changes and increases in the well-being of many in our community, because GDP per capita might have risen, but we still have a situation where over 2 billion people live on less than $2 a day. 20% don't have access to electricity, and I think over 30% of the population don't have access to basic sanitation. So innovation itself, be it technological or social, hasn't delivered the sort of improvement in living standards across the board that we would like, because what we want innovation to be is accessible and affordable to those who sit in the bottom 40% of our societies, and it must create better economic opportunities for them. And what we're going to be talking about today is that type of innovation, namely inclusive innovation, where innovation policy meets development policy, particularly around how we can harness innovation to enhance the economic and opportunities and the welfare of the poor. India has long been a leader in this space. It's long led as a centre for experimentation, for thinking about inclusive innovation, and this leadership has been across many different dimensions and many different sectors. It's led in the development of technologies and products that are inclusive. It's led in developing business models and interventions that are inclusive across a whole wide range of sectors. Not all of these have worked, and one of the reasons that inclusive innovation agenda is so big in India is because India continues to have a wide range of issues, but it hasn't stopped India from continuing to think and to experiment and to test on how to make inclusive innovation work. And that's why we're really delighted to welcome Dr. Mashelkar to give this webinar, because he's very much one of the global leaders in this inclusive innovation agenda. Dr. Mashelkar is chairman of the National Innovation Foundation, which I think he might explain a little bit more about. He previously served as Director General of the Council of Scientific and Industrial Research, which is a large global, India-based but global applied research organisation. He's been deeply connected with the innovation movement in India. He's currently chairman of India's National Innovation Foundation, and a member of the I-20, which is the global summit of innovation leaders. I can probably read his CV, and that would take up about 20 minutes of the webinar. I won't do that. I will note that he was awarded in 2005 Business Week's Award of Star of Asia, and he, as I said, he's been deeply involved in this inclusive innovation agenda for many years, and that's why I'm delighted to welcome him, and I'll hand over to him. He'll probably be presenting for about 30-35 minutes, and then we'll have a chance to pitch questions at him. So as you listen, please add the questions in the chat, and then we'll have an interactive session. But well, I should say Indian time, good evening, Dr. Mashelkar. It's good morning Washington time, and I suspect we've got listeners from all around the world. But I'll hand over to you, and very much looking forward to your presentation.
Thank you. Thank you very much, Justin, for that very kind introduction. I must say that this is a very great honor, a very special privilege to join you all and to speak on a subject which has been close to my heart, something that I have devoted my last few years in developing not only the concept but taking the concept forward around the world. I want to begin by defining inclusive innovation because there is a lot of confusion one finds with regard to what is exactly inclusive innovation. In fact, I remember there was a meeting in Harvard where almost half a day was spent on defining what is inclusive innovation. So I like to begin by sort of defining inclusive innovation in a rather formal way so that we are all on the same page. I would say that inclusive innovation is any innovation. And by any, I mean it could be technological, it could be non technological, it could be a business model, a system delivery innovation, any innovation that leads to affordable access. I think affordable is a very, very important word of quality goods and services, not knockdown goods and services, quality goods and services, creating livelihood opportunities for the excluded population. And this excluded population, the exclusion could be because of a variety of reasons. They could be economic, they could be because of gender, they could be because of disability, and so on. And these people are primarily at the base of the pyramid, economic pyramid. And inclusive innovation serves you on a long term, sustainable basis with a significant outreach. And that outreach is important because if you really want a total inclusion, you are dealing with 40% of Earth's population. Now, what I want to emphasize right in the beginning is the fact that inclusive innovation is not about stripping products and services to make them cheap somehow. That is doing less for less. No, it is more from less. Inclusive innovation is about giving high quality at affordable prices. That's extremely important. That distinction is extremely important. Now, you can see a major movement on inclusive innovation around the world, especially during the last 5 to 6 years. What are those drivers? First of all, as far as the emerging economies are concerned, you will see that there are rising incomes, but also rising aspirations for high quality goods, services, and so on. And while the incomes are rising, the inequalities are also rising. And this is causing social disharmony. So, therefore, we have to deal with this problem. As far as the enterprises are concerned, they see markets, they see consumers. For example, as poor become lower middle class become middle class, we are creating a new billion customers, and it's very interesting that these customers are essentially the ones who have low purchasing power, but at the same time, they have great aspirations in terms of having quality goods and services. I am going to take you through a view through my personal lens. And I remember I and late C.K. Prahlad was a great thought leader, as you all know, who wrote that famous book on wealth at the base of the pyramid, bottom of the pyramid. Here I wrote this paper. Unfortunately, it turned out to be his last paper in Harvard Business Review, July-August 2010. And the title of that was Innovation's Holy Grail, getting more from less for more. It meant not just more from less for more profit, but for more people. How do you get that? And we have shared the Indian experience of doing it because India always had great scarcity of resources. Some happened because of some historical fact, but others were created by ourselves in terms of our policies. But at the same time, with scarcity, we had great aspirations. And always scarcity and aspiration is a great combination. I remember after this paper was published in July, August 2010, within 6 months, there was a special session on more from less for more in World Economic Forum where this issue was discussed. And interestingly, I was invited to give a TED lecture, Breakthrough Designs for Ultra Low Cost Products. Basically, it was about, again, looking at disruptive innovations to create high quality goods and services for the base of the economic pyramid, which will meet the highest quality standards. This lecture, I'm happy to see, has been translated in some 23 languages, and to the last count, I saw there were 500,000 views on this. So therefore, this message has been spread, I must say, all across. Now, if you look at inclusive innovation, the definition that I gave, what are the special characteristics of that? First is, of course, affordability. The second is accessibility. Something may be affordable, but if it is not accessible, is of no use. Then there is this very important issue of scalability. It has to scale because for true inclusion, you have to reach not just 10,000 people, 10 million people. Then sustainability on its own, otherwise it's of no consequence. And finally, as we emphasize, the quality. Now, a lot can be said about each of these factors, how difficult or easy it is to achieve those. Affordability, yes, people have achieved it. For example, if you look at the affordability in terms of quality of, in terms of the price performance point, etc., they have been. But if you look at the scale and sustainability, there has been a big challenge. Now, scaling gets discussed now around the world because people now say, don't keep on giving us the same examples of inclusive innovation. Show us where they have scaled, what difference it has made. I think the first point about successful scaling, I would like to put down 5 mantras. The first is, of course, go for affordable excellence. That's extremely critical. Because what does affordability do? It gives you equity. But excellence gives you global competitiveness. And that's a terrific combination. The second is build an entire ecosystem to support the scale, not just a standalone venture. And all examples where large scale has been reached are ones where the entire ecosystem has been operational. The next is focus on end-to-end innovation. I mean, there are examples where people had brilliant technological innovations, but because they did not have good business model innovations or system delivery innovations, etc., they could not reach the customer. And last one is remove the internal barriers to inclusive business. I think these are extremely important. Now, internal barriers I will talk about a little later, but there are a number of external barriers to inclusive business which comes from inclusive innovation. They could be financial, infrastructural, regulatory, marketing, distribution, sales, and particularly lack of collective action with government, local NGOs, etc. Because finally, we are trying to reach out to the last man or a woman at the base of the economic pyramid. So involvement of all these becomes very important. Now, in terms of financing, we have to start thinking out of the box, explore non-traditional financing, because if you think you will have a technological innovation which can lead to inclusion, and you can hope to go to a standard venture capital firm, let us say, I don't think you will get that support. Non-traditional financing is very critical, like DEFID's Business Innovation Facility, USAID's Development Innovation Venture, social impact funds like the Acumen Fund, Grey Ghost Ventures, guarantee facilities like Root Capital. In India, the government has created a special Indian Inclusive Innovation Fund. It is aimed to achieve a target of $1 billion finally, $1 billion. Currently, $100 million are on the table, but exclusively devoted to inclusive innovation. In India, there has been another innovation that 2% of profit after tax of companies has been now reserved for social corporate responsibility exclusively, and the companies have to spend this money, and almost 6 billion to $7 billion are currently available under this category. I think all these become non-conventional, non-traditional financing routes. The other point I want to make and emphasize is that we have to have a paradigm shift, because we always thought that as far as the poor are concerned, they can do for less because they're lesser people. So less for less. No, sorry. We have to go for excellence, high quality, which means more from less, not less from less. We have to make it affordable, that means for more and more people. So the real mantra has to be more from less for more people, while we make profits too. Now, you might say, can you give us an example of affordable excellence? How does it work? I want to give an example by saying that it's not a dream, it can be a reality. I'll give you a case of hemoglobin detection. There was this young man, Mishkin Ingawali, just a 28-year-old boy, who said, I can understand why people die of cancer, but I don't understand why they die of anemia. He went to villages and he found that the women were reluctant to give blood. And without taking a blood, you can't detect hemoglobin. So he said, fine, I will not take the blood, but I will detect hemoglobin. That means it was a non-invasive device. And there, he wanted it to be affordable because the costs had to be reduced, and it was not 25%, it was 25-fold reduction in price that he talked about. That means a $25 test, he said, I'll do it at ultra low cost, half a dollar. The other one, he had to do excellence because you are now trying to change from invasive, where you push a needle and take the blood out, to needleless, non-invasive. And that can be achieved only by using highest level of technology. And he did that. And you can see this device that he sort of created. It's called Touch HB. And I want to emphasize that he used high technology like photoplethysmography, spectrophotometry, sophisticated photon scattering software, etc. And doing that, he reached also the price target that he was basically talking about. And you can see him receive this particular award. This is an award that I have created in the name of my mother. It is called Anjali Mashelkar Inclusive Innovation Award. And this was the one that he won in 2012. In fact, Mrs. Anuaga, the lady that you see there, was the chief guest. And you can see me standing there holding his trophy. But when he came on the dais, very dramatically, he put that Touch HB around her finger and said, Madam, 12.7, take care. Now you can see what impact such a non-invasive device, which is so cheap, just half a dollar, one quarter of a dollar, I would say, can actually make. This is an example of affordable excellence. Affordable because it's very low cost, but at the same time excellence because you use cutting edge technology to make it happen. That is what we should be aiming at. Now, there are a number of examples of affordable excellence in India. Just like Justin was saying, India has experimented this for a long time. Like, can you make a hepatitis B vaccine of a very high quality, which is not 40% cheaper, 40 times cheaper? Answer is yes. A recombinant hepatitis B vaccine has been done in India. A cataract eye surgery, not 100% cheaper, 100 times cheaper. Not $3,000, but $30, but of a very high quality, has been done. And in fact, if I had more time, I would have shown you a comparison of Royal College of Ophthalmic Surgery, their results, and the Arvind Eye Care results. These are the people who do the cataract eye surgery. And you can see that in all 9 parameters, they beat them, which means affordable excellence. Open heart surgery, 20 times cheaper, Narayan Tudalaya, exactly the same, and the results are as good as New York surgeons. And artificial foot, which is 300 times cheaper, but performs again outstandingly well. And all these are not dreams, it has been done. So why can't we do more of it? What are the lessons that we can learn from this? Now, if you see, the challenge before us is really The income inequality that I talked about a little earlier, they will take a long, long time to go. They will take generations. We don't have that sort of a time. So the challenge that we have is, despite this income inequality, how can we ensure access equality? Just like affordable excellence was contradiction in terms, because how can affordability and excellence go together? This also is a contradiction in terms. How can you have income inequality and access equality? And you can see in this picture, these two ladies, there is nothing common between them. Maybe the income inequality is 1,000:1, but the access equality is 1:1, at least as far as the voice communication is concerned. How did that happen? This was inclusive innovation. It started with a policy level innovation by the government of India, where they say no more copper lines, no more landlines. We will go primarily for voice over internet, voice over mobile. BSNL was created. There was a wide sort of you know deregulation and so on and so forth. So this became extremely sort of interesting policy level. But then you had to have a handset which had to be cheaper, not $250, which that poor lady could not afford. Can we do it for $25? And yes, it was done. By whom? By the Nokia, the Ericssons of this world. Now, even if the handset was $25, but the phone calls were 10 cents per minute, what would have happened? That poor lady would not have been able to use it because her income would be $2 per day, 200 cents per day, 20-minute call and it's gone. So therefore, the call rates from 10 cents had to come down to zero point 0.1 cent, a fraction of a cent. And that was a business process innovation that the Reliance and the Airtels of this world did. These were Indian companies. And in fact, those of you who are interested in seeing how this innovation was done, you can go and see the paper in Harvard Business Review by me and C.K. Prahlad, and you will see a brilliant case study of this. The simple point I'm trying to make is that it's a combination of variety of innovations which made it possible. So therefore, I think what we have to recognize is that the big question is really get back. Get back. It doesn't matter. There was one slide that one is missing, and that had to do with the fact that not only do we have the technological innovation, but business model innovation, system delivery innovation, workflow innovation, um, organizational innovation, policy innovation, and it is the combination of all these that finally works. That slide is not coming up, doesn't matter. I think the big question now that comes up is why should, let us say, I mean, this is fine for emerging economies, the Chinas of this world, the Vietnams of this world, Indias of this world, but why should EU or OECD be interested in inclusive innovation? In fact, I gave a talk in European Union's Innovation 2014 in Brussels, 11 March, and the title of my talk was Innovation Under Adversity. And I still remember there was a particular question that was asked to me. And that question was, why should this be important for Brussels, for European Union? And somebody else answered it on my behalf. He said, don't answer, I will answer. And the answer that the gentleman gave was, if inclusive innovation delivers access equality, despite income inequality, then EU needs it here and now. Just look at the income inequality among the 28 member states of EU, and then the need to create access equality across EU. And therefore, there is a wider repercussion, and this was a comment by an EU leader during the Q&A. Now, European Union had asked me to do a report on organizing inclusive innovation for accelerated inclusive growth. And if you look at its contents, you will find that one of the chapters is European Union and inclusive innovation, the opportunities and challenges for private sector in European Union, for research institutions in European Union, for the European Union government, and so on. And interestingly, OECD is taking a deep interest. In fact, I was there in the OECD organized conference on inclusive innovation for inclusive development in Delhi yesterday, where people around the world have gathered. And OECD is going to bring out a report from their perspective on the same issue. So the main point I want to make is that this message is spreading very widely now, whether it is European Union, whether it is OECD, and others. Now, there are these big companies. There are other compulsions. Like what Jeffrey Meld says, the CEO of General Electric, and these are all big multinational companies. Why should they be interested? They say, if we do not come up with innovations in poor countries and take them global, new competitors from the developing world, the Mindray, the Suzlon, the Goldwind will, and that's a blessing prospect. Or in other words, they are saying this is a must for us. And in fact, Jeffrey Melt has written a wonderful paper in Harvard Business Review, how GE is disrupting itself by doing what he calls as reverse innovation, which leads to inclusion. Now, GE's inclusive innovation, if you just see, the electrocardiograph machine, ECG machine, not $10,000, they are doing it for $600 now. And who are doing it? The Bangalore engineers of GE Healthcare managed to do that. I was in China and I saw a brilliant example of an ultrasound machine, not $30,000, but just $1,500. And this was done by Chinese engineers. And you can see Jeffrey Melt with that. And what has happened is that these products, which are of very high quality but affordable, are now finding marketplace, getting entry into the markets in Europe and US. As a matter of fact, just selling this device after they had introduced this particular product, more than $250 million was the revenue that GE generated out of this product. So I think you can see it's very profitable and makes a big business sense. And not only that, they say, Jeffrey Melt said that GE plans to spend $3 billion till 2015 to create at least 100 healthcare innovations that will substantially lower costs, increase access, but he says at the same time, and improve quality. That is the important point. Affordable excellence. Now, they are not the only ones. There are other companies that are coming in also. Now, in order to get into inclusive innovation, doing inclusive business, you will have to change the mindsets, basically, because the current practices, management styles, strategic thinking will not work. We require a new mindset. For example, technologically sophisticated performance-rich products with many features is what the old mindset was. The new mindset has to be frugal, functional, but high-quality products. The conventional mindset is remove features to reduce costs. No, the new one is reinvent the product from ground up. For example, in India, Sutucool is a refrigerator, low cost. You cannot believe it, it is just $69. Now, supposing they had stuck with the same technology, that is the compressor technology, there was no way they could have created it. They had to go entirely for new technology that is solid state electronic based. So, ground up, you have to rethink. Premium price, high margins has been the old mindset. No, it has to be affordable price, high volumes. Technology push, product out approach has to be replaced with customer-centric, market-based approach. In fact, in inclusive innovation, the customer gets deeply involved. In fact, the rural women were deeply involved in actually co-creating this low-cost refrigerator, by the way, because the GE engineers went and stayed in their huts for a number of weeks actually before coming out with the design. The current market's old money has been the old approach. No, new markets, new money. I talked about the emerging billion market that we are talking about. And most importantly, the use developed world products to transform emerging markets. No, your new strategy has to be build new global growth platforms based on emerging markets. Finally, I would say that for inclusive innovation, one cannot innovate alone. The government, the private sector, the civil society, the knowledge institutions have to be involved. Just to give an example, for example, the government policy on mandating institutions to drive the inclusive innovation agenda, they should do that. They should incentivize public and private sector to partner in R&D leading to inclusive innovations. Then public procurement, guaranteed offtake, price subsidy for inclusive innovation products and services become very critical, particularly in the early stage. Targeted funding for inclusive innovation, like India has created the special Indian Inclusive Innovation Fund. Fiscal incentives for inclusive innovation are critical. Let me just give you an example from my own perspective of the way we approached it. When I was the Director General of CSIR, we launched this New Millennium Indian Technology Leadership Initiative, and we gave some grand challenges. The grand challenges was, it was almost saying that something that was available for 80,000 rupees, a multifunctional PC, can we do it for 10,000 rupees, substantially affordable. And you can see it was created. It was Mobilis, a $200 laptop that was created by here that you see on the left hand side, and the Minister Kapil Sibal you can see in the middle. And that, of course, was commercialized. It did not become a hot sell because there was something that was missing in moving it forward into the market. But this has led finally to an Akash, which is a $35 tablet. And tablet in the hand of a minister is fine, but finally the tablet has to be in the hands of these kids that you see here. All right, and you can just imagine a $35 tablet getting into the hand of millions of children in India, what a transformation it would be. That is the power of inclusive innovation. That is the way government interventions can work. Let me also look at the issue of knowledge institutions. Like it was mentioned while I was introduced that I'm the president of Global Research Alliance. This is a great institution. You can see here, Battelle from US, CSR from India, CSR from South Africa, CSR from Australia, Danish Technological Institute from Denmark, Fraunhofer from Germany, Serum from Malaysia, TNO from Netherlands, and VTT from Finland. We are all come together. We are 60,000 scientists, engineers, and technologists, and we are working on inclusive innovation project like green and low cost wireless communication network for Africa, which is currently work in progress. And there our institutions like Fraunhofer from Germany, TNO from Netherlands, and others are coming in to put it together. We are working with countries like Vietnam. I'm very proud to say that this was a workshop that was organized by the World Bank. And you can see my friend Vinod Goel, who is also attending my talk here from the World Bank, being there just behind me in the middle. And he and I worked actually together to create, to design this, conceptualize and design this $55 million sort of World Bank project, which has started about 6 months ago. And the idea is developing inclusive technologies, scaling up, capacity building, and so on and so forth. And very interesting, after this project was launched, there have been a number of other countries who are wanting to come together. I find that the Deputy Prime Minister of Prime Minister of Vietnam was very instrumental in championing this, and he summarized it very well. He said, if I do inclusive innovation, on one hand, I will have industry competitiveness, particularly if I develop outstanding products, but at the same time, because they are affordable, I will have increased quality of life for the poor. So it's actually a completely win-win situation. I think that summarizes the essence of why Vietnam has gone for this, why other countries are going for this. China, we are together again, and you can see my friend, who are from World Bank, myself, and many others from China, looking at inclusive innovation in the Inclusive Innovation Summit, and they are launching a major movement sort of on this. So I'm very happy to say that this movement is spreading across the world. Finally, I want to thank you all for joining me. I'm looking forward to the question and answer session when I'll be happy to interact and provide any additional, let's say, information, details that I can provide and also benefit from you. Thank you very much.
Well, thank you very much, Dr. Mashelkar. That's fascinating. And before I get to some of the questions from our participants, something you said earlier, and I'd be interested in following up with you. You mentioned that it's important to, when you're developing inclusive innovations, to think about building the ecosystem around those innovations to help them scale. And secondly, you noted that you should be thinking end to end. Could you possibly explain a little more about what you mean with both those concepts? What is end to end thinking, and also when you're talking about building the ecosystem, what does that mean?
Justin, there is an echo from your machine. If you can please switch off your speakers while you're speaking, we will not get the echo. No, you've put your machine on mute.
Okay, can you hear me now?
Much better, yes, thank you.
Yes,
all right.
You can please repeat what you said because I couldn't hear anything.
Two questions around, you mentioned earlier it's important when you're developing inclusive innovations, firstly, to build the ecosystem around the inclusive innovation, and secondly, to take an end-to-end approach. And I'd be interested in hearing what that means in practice, and maybe the example that you're using, the non-invasive device that you gave the award to. How did the ecosystem get built around that, and also what was their end-to-end approach?
I think it's a very important question. Let me take a simple example to illustrate what I'm saying. One of the great examples of inclusive innovation is the Tata car Nano, a $2,000 car, which represented really affordable excellence of a high order. Affordable because it was just $2,000, and excellence, if you can believe it, there was such innovation that it had 76 patents by the way. Okay, so a technological marvel to get a fuel-efficient 25 kilometer per liter car, Euro 4 standards, very safe, comfortable, and so on. But it did not become a market success. Why? There was no end-to-end innovation. And what was missing? Was marketing. It was affordable excellence, so therefore, excellence should have been projected at the front end and affordable at the back end. The reverse was done. Affordable was put at the front end, and affordable became cheap. And the aspirant, new sort of set of customers that I've been talking about, they wouldn't go for a cheap product. Okay, so there's the marketing mistake. The second is the first-time buyer, because you are looking at the first-time buyer of a car. All right, and he has hardly visited a showroom. He does not go to the showroom. The showroom has to come to him, because if he goes to the showroom, he sees Tata Jaguar Land Rover sitting next to, parked next to a Nano. You can just see the effect. So there was marketing innovation that was required. Similarly, bank guarantees. I mean, you are talking about people, some of them don't have bank accounts. How can they give bank guarantees? And so on. So that is what I meant by a business model innovation, system delivery innovation, marketing innovation, going to the customer, go to customer sort of approach. So all along the way, you have to complete that ecosystem. Now, as far as your question about the Touch HB, that is the hemoglobin detection machine is concerned, I must admit that it was an individual whose compassion, when he saw the villagers and women dying of anemia, that led to the creation of this. And that was a wonderful startup, young company, by the way, whom we are now hand-holding to make sure that it becomes a commercial success. But in terms of innovation ecosystem, what I'm trying to say basically is that you can create a great breakthrough, whether it is in MIT D Lab or George Whiteside's lab in Harvard, where he has done, for example, a very low cost diagnostics paper-based, where your liver test can be done for 2 cents, and so on. So there are many of such low cost sort of innovations. But the innovation ecosystem has to sort of support through different means. As an example, I said that when I gave the challenge of not $2,000 but a $200 laptop, it was done, but it did not become a market success, because that initial support from the government on, let's say, procurement, right procurement policies, assured offtake, etc., so that the initial pump starts in the right way, just did not happen. But that's not happening in the case of Akash. Akash, there is such public procurement support so that it gets kick-started. All right, that is a part of the ecosystem, and I can give half a dozen other examples. But that's what I mean. Unless you have the total system in place, you wouldn't make it.
Thank you. One question from one of our webinar participants, querying the difference, if there is a difference, between inclusive innovation and social innovation.
We have, in inclusive innovation, as I said, technology coming in a big way, of course, but also several different mental processes that you can use in order to think differently, sell differently, market differently, create different business models, business processes, workflows, etc. So that is inclusive innovation. For example, take Arvind Eye Care, all right? You might say, how do they move from $3,000 to $30? They do what is called as a workflow innovation. That is like McDonald's, for example. They use that particular approach, an assembly line approach, in order to make that happen. Now, that of course results in sort of a great deal of social benefit. There is no question about that. For example, the number of patients they do cataract surgery on is around 300,000, out of which 60 to 70% are poor people who regain their eyesight and so on and so forth. So there is a social difference that you make. But there are social processes where you can do social innovation of a different kind. Let me give an example. Currently I'm chairing the committee, what is called as a Swachh Bharat Technology Expert Committee, that is Clean India Technology Expert Committee, because the aim is to make India defecation free by 2019, open defecation free. Now here, the challenge is, yes, we want inclusive innovation there. We want toilets, let us say, that are affordable, scalable, sustainable, rapidly deployable. But at the same time, it's not about toilet engineering through inclusive innovation, but social engineering. You can build the toilet, but who will use it? There is a classic example I will give you. One Maxis Award winner was talking to me from India, and she told me something interesting. I'm just illustrating the social innovation component of it. That the toilets were built in their villages, but the women would not use it. And she got a social scientist involved to see why they are not being used. And what that social scientist found was that in the morning, apparently the women did the whole thing together, the entire process. And that was the time for social interaction, talking about their father-in-law or maybe a child who is not doing well in the school and so on. And that social interaction was missing when they got locked up in those cubicles, the toilets. So she said, you will have both. And you know what she did? There's a very interesting innovation where she built semicircular row of toilets where everything about this was open so that they could talk. And can you believe it? The use of toilets moved from 0% to 100%. That's social innovation. Okay? So, all sorts of top technologies could have been used to create the best of the toilet that you had, you know, in less water, even waterless. But it would not have been used if this issue was not taken care of. These are the subtle differences.
Great. That question to some extent from one of our participants is the relationship between inclusive innovation and open innovation. Now, you've mentioned with a couple of your examples, indeed just the last example, that involved the users, and maybe it didn't involve the users early enough in the process, but also earlier you talked about co-creation in one of your examples. So would you like to say a little bit more about the relationship between open innovation and inclusive innovation?
I will explain that. As a matter of fact, because of the limited time that I had, I did not put up some of the slides which I normally do. I said inclusive innovation is not just technological innovation, business model, workflow, system delivery, but also research process innovation. Now, open innovation that one talked about, there is a brilliant example of open innovation leading to inclusion. CSR, Council of Scientific Industrial Research, which is a chain of 38 laboratories with around 20,000 scientists, engineers, and technologists, which I have the fortune to lead for almost 11 years. Uh, After me, Dr. Samir Brahmachari, the Director General, who took over, had a brilliant idea of what he called as open source drug discovery. We always complain about healthcare not being affordable, the therapeutics being very, very expensive, and all goes to the costs of making the drugs finally, discovering the drugs, developing the drugs before they are delivered. So, supposing these costs are drastically brought down, how can we do that? Well, normally drugs have been discovered by multinational companies, let us say, with their very expensive scientists and very expensive setups that they have infrastructure. Can we use multiple brains around the world to do that? So he got this brilliant idea of open source drug discovery. He created a platform, and those of you who are interested can go and visit that platform, OSDD. And today, as I speak, 146 countries are participating. More than 5,000 scientists, researchers, etc., are participating in this from these countries. And you cannot believe it, 30 to 40% of them are young people. Young people means they are undergrads and so on and so forth. When was the last time you thought of undergraduates getting into research on drug discovery? But this has made it possible because it's this open source, and they're working on, by the way, on the tuberculosis, which is disease of the world. So open innovation is very much part of inclusive innovation because it makes things affordable, but also by co-creation. You know, when 5,000 brains work together, you can just imagine what difference it will make. It can make a tremendous difference. We have to take such movements forward.
Good. Thank you for that. That leads me very nicely into the next question, which a couple of people have posed, which is around the relationship between inclusive innovation and intellectual property rights, and how, well, firstly, whether intellectual property rights has been an impediment to some of the work in inclusive innovation, or whether you've been able to overcome it, and if so, how. So could you say, I mean, the drug example is a fascinating one, given how intellectual property is intertwined with that whole industry. So how does inclusive innovation work with intellectual, especially formal intellectual property, patents and trademarks, etc.?
This is a very important question. See, the challenge is the following. Whenever we talk about intellectual property rights, the discussions become intellectual property rights versus the rights of the poor. It should be intellectual property rights and the rights of the poor. All right. So we have to change the dialogue to start with. The challenge becomes most critical in the area of particularly drugs and pharmaceuticals. I remember I was a co-chair of a WHO Commission on Intellectual Property Rights, Innovation and Public Health. Madame Ruth Raffus, the former president of Switzerland, was the chairperson, and we have come out with a report which is available on the WHO website. And those of you who will be interested, please do visit that, because there is a specific chapter on this very issue of how to deal with the intellectual property rights issues to make sure that the rights of the poor are also preserved. Now, there are a number of options that are coming up. The first is the policy option, of course. I mean, don't forget that a poor country like India, because it had a particular intellectual property policy regime, without increasing the price of the drug, because we became masters in creating generic drugs. Today, our life expectancy from the time of independence, that is 1947, has doubled up, basically, all right? Although that capacity to buy those expensive drugs was not there. That was simply because of the patent laws. So policy interventions can make a difference. And that is where, for example, differential pricing, etc., become sort of important. So that is one issue. The second is, a lot of intellectual property that gets generated is not used, actually. And there are now companies, including multinational pharma companies, who are actually making these sets of intellectual property accessible to people. There are patent pools, for example, that are being built, which are also getting used in order to take these forward. So there are half a dozen different ways by which we can convert this debate of intellectual property rights versus the rights of the poor, and say they are and the rights of the poor, and preserve both. Give returns to the inventor, but at the same time get access to the societies who most need it.
Great, thank you for that. A couple of questions have come in around the role of government in this agenda, and you mentioned firstly that both the Indian and the Vietnamese government have been supportive. Perhaps one question, has Indian government at its various levels, has it always been supportive? Does it sometimes get in the way? And what are perhaps two things which are particularly important for government to do in order to push forward with an inclusive innovation agenda?
I would suggest the following. First of all, we must have an integrated national inclusive innovation policy and create the required institutional systems. For example, India now has a science, technology and innovation policy and an inclusive innovation policy. The second is to create a facile regulatory system and supportive public procurement policies. And I gave couple of examples on how these become important. The third is creating a dedicated fund to support inclusive innovation, just like India has done. And that can include private risk capital also for pro base of the economic pyramid solutions. Then we have to create incentives to leverage the strengths and comparative advantage of all stakeholders, including the private sector. We have large public research systems, like you saw the Global Research Alliance. 9 sets of public research systems have come together from 9 countries whose GDP per capita is from $1,500 to $55,000, with a common goal of doing inclusive innovation. So we have to make sure that the best of the minds get their mind space occupied solving these particular problems, because there is always a debate about what are the incentives. If my promotions are going to depend upon the number of research publications that I have in peer-reviewed journals, and you're asking me to do inclusive innovation or solve the problems of the poor, why should I do that? Now, I think we require innovations there. I'll just give an example. Academy of Scientific and Innovative Research, which has around now 2,800 PhD students working, by the way. It's a university created by the Act of the Parliament. I happen to be its first chancellor. And what we have done, we have got it integrated. There are 4 credits that are given for the work that they do on inclusive innovation. They have to go and stay in a village, for example, for 4 weeks, and so on and so forth. So it is not something that is peripheral. We are trying to make it at the very core, and you require these sorts of innovation. Then mandating public research institutions to channel their best technical and scientific resources towards inclusive innovation. Why is a Stanford University creating a $25 incubator for the poorest of the poor? Because that has been integrated in their systems. Why is George Whitesides, the highest cited scientist in the world, creating, let's say, a $25 sensor, but at the same time publishing that work in Proceedings of National Academy of Science? You can do the best of science, he demonstrates, as well as create a solution that will help the billions. So I think that particular change we have to have. And finally, the governments must make sure that the national, regional, as well as global scientific, technological, and innovation organizations come together to make it happen. The ministries in the government, for example, it's not just the job of the Science, Technology, and Innovation Ministry. It is the Rural Development Ministry, the whole range of other ministries which deal with social inclusion issues. They have to basically come together. Today, they don't talk to each other. That cannot basically work. So I would say this is a kind of a 10-point agenda I would put before the governments.
Well, thank you very much. I think we've probably come to the end of our session. May I, one of the questions we haven't got to, Dr. Mashelkar, is a request from Uganda to be involved in the Global Research Alliance. So we may have found a new partner for you, but we might follow up on how that can happen. May I thank you on behalf of the World Bank Group for participating in this session. For those who are dotted around the world, and we have people in Vietnam and Hawaii and Wales and America and various other places. It's 9:30 at night here in India, and Dr. Mashelkar has taken time out from his evening to give this presentation to us, and I'm most appreciative of him doing so. So thank you very much on behalf of the World Bank. We'll continue to answer questions online, those we didn't get to. Please keep posting them and keep an eye on the website. And somebody from Lima, Peru, good morning probably to you as well. So we're happy to